Hey everybody, welcome back. We are here with our sponsor, Dr. Rhys Branman of the Cosmetic Surgery Center. We're going to talk about some amazing results of skin removal surgery. This is especially after a massive weight loss, right?
That's right, that's right.
Good to have you.
Thank you very much, and thanks for having me. Appreciate it.
Okay, so, I mean, they want to lose the weight, but
That's
they
right.
have this image in their mind of what they're going to look like, right?
That's right. And if you think about it, when people have a lot of weight, that skin has to accommodate that weight. And so the skin stretches. And when they lose the weight, especially if they lose it pretty quickly, either through diet or exercise or through something like a gastric bypass or a lap band, that weight disappears very quickly, but the skin doesn't bounce back. In a lot of people, it just stays in the sort of envelope of what they used to be in that larger weight. And it's sort of like if you deflate a balloon, you've got a lot of excess skin, and it's loose excess skin. And the problem is there's no muscle in skin, and so you can't exercise it to tighten it up, and it just stays loose. And
now, if they've only lost, 10 to 20 pounds, which is great, it'll bounce back some.
Yeah, 10 to 20 pounds, it's going to bounce back. But these individuals are people who lose 50, 100, 150 pounds or more, and they just have excess skin, and there's no way of getting rid of it except through a surgical procedure. And a lot of times people say, well, I look good in clothes, but I just don't look good in, let's say, a bathing suit.
Right.
And the issue really comes into play is that a lot of them have problems with the overlapping skin. You can get infections, it can cause chafing and just constant irritation. So many times we need to do this for those reasons alone.
Not just the cosmetic.
Just for cosmetic look.
But they've done all this hard work to lose the weight. You want them to feel good.
And you do want them to feel good, and they can feel good if they come in and get that taken off.
Okay. I think we've got some before and afters we're going to show you of some of the folks who have done this.
That's right. And
it's
so
amazing.
We're showing you some pictures of patients who have had tummy tucks, or they've lost a lot of weight from just they've got a large, what we call a pannus, which is an excess amount of tissue that overlaps the pubic area and sometimes goes on to the thighs. And so here is a patient that we did liposuction as well as removed some of that excess skin. Yeah, they lost a fair amount of weight, but then they still had excess skin as well as a little bit of excess fat.
Right. It's almost a six-pack over on the right.
It's almost a six-pack on the right.
Looks fantastic.
Yes, and this next case is where a similar thing where you've got a lot of excess skin. It wraps around the whole waist area, and so we get all the way past the midline of the waist and kind of bring that around and get a lift of the waist area. We get a lift of the abdomen. We get them a new belly button, and then now they're like flat. They can put on a bikini and go out there and strut their stuff.
So on the left, that's not fat, that's just skin hanging down.
And then the next is even more dramatic, where this patient had a dramatic amount of weight loss. We call that a massive weight loss, over 100. And they've got excess skin at the top of their tummy. They've got excess skin at the bottom of their tummy. And there's no way of actually removing that by just making a low incision. We have to make an incision right down the middle and bring everything in. Matter of fact, their entire front of their abdominal wall that you see there is gone. We've recruited all the tissue from the sides and brought it to the center.
That is amazing.
And so that is how you get rid of this tissue. And
is it pretty invasive?
It is pretty invasive. We have to free up all the tissue. Literally, we have to free up all the tissue in the front of the abdomen, and then we bring it up in front and bring it together. Recovery is going to be 2 to 4 weeks. We do this also on the arms, where you have excess skin on the arms. We do it in the medial thighs, or the thighs where you've got excess skin here. And so this can be done, usually we do it in a staged manner. We do maybe the abdomen and the arms, or just the abdomen, then we go to the arms and do each procedure in a stage. So it does take some time to get these procedures completed, but once they're done, the incisions heal very well, and the patients are a lot happier because they just look more, as they would say, normal.
Yeah, as they're talking to their doctors about the weight loss surgery, they need to ask these kinds of questions too.
Absolutely.
And then go to someone who's board certified for the
Yes.
surgery, right?
Yes, they just need to understand that it is a process, and it isn't just the weight loss alone isn't going to take care of everything.
Yeah. Do you have them come to you and they're like, you know, I've lost all this weight, but I just still
Yes.
don't like the way I look? What do
Yes.
they say?
Yeah, they say that, you know, I want to go to the next stage. And a lot of them understand that it is a process
Right.
and that they want to get rid of that excess skin which is causing them problems.
Okay. If you or you know someone who has lost a large amount of weight, congratulations to them.
That's right.
But if they want to take the next step, then you can
Yeah,
certainly help them with that.
Absolutely.
Okay, thank you so much. Here's the information about Cosmetic Surgery Center, whether it's this procedure or some of the many, many others that they have there on Executive Center Drive. You can certainly go to the website or give them a call and ask any questions. They will answer them. Thank you.
You're welcome.
Good to see you.
Good to see you too.
Okay, back in just a moment. We're going to talk about fitness routines up next.